Welcome everyone to this year's Therapist Throwdown, also known internationally as the most challenging live competition in mental health training. My name is Alex Vash, and together with Tony Rumenair, my colleague, we will be your co-hosts for this event, which is sponsored by the International Deliberate Practice Society and the Sentio Counseling Center. So just a quick word on what the Therapist Throwdown is. I know a lot of you already know, so maybe this is your first time attending. The Therapist Throwdown is a competition where brave student contestants respond to videos of standardized psychotherapy clients. And so just so everyone knows, previously, over 60 courageous trainees from around the world participated in a preliminary round by submitting videos of themselves performing therapy with videos of actors playing mock therapy clients. So the top scoring trainees from that preliminary round have advanced to this final round of the Therapist Throwdown. And before I start presenting the contestants and everything else, I'm gonna pass the microphone to the current president of the International DP Society, Hanna Maya. Hanna.
Thank you, Alex. And everybody, welcome. I'm really glad to be able to have this throwdown this one time, the first time presented by the International DP Society, and I thank Alex and Tony for giving us this opportunity because they have been doing this in previous years. So we had 60 people registered in for preliminary round and around 10 really gracious ones did send in the videos then finally. So it was a challenge. And now we have the 3 finalists here today to go around this final competition. And I'm really glad we are having so much people watching and being part of this. And actually we had almost 70 registered to come and watch this. And I hope you will always be then also in other IDPS events. I will put the website info on the chat so you can look at the other events which are coming in IDPS. And if you like to join, please do, to make DP even more promoted and known and practiced all over the world. We have people from so many countries that it's amazing now from all the continents, and it's great that you all found this place because we were kind of worried how the time zones will go, but I'm glad you are all here. And there's one issue I wanted to raise this time, and because of this international spirit, also the cultural differences with these skills. And like you know, we have always criteria for skills, and in criteria we have often also like non-verbal things which we think are part of performing the skill also today. And we have come to notice and being aware that there are many differences in cultural differences, what's kind of considered as appropriate nonverbal expression of empathy or persuasiveness or affirmation or anything like this. And at the moment, I guess we just don't have any answers to that. But if you are interested in these kind of things, please come and join our society, and we try to figure out how to take these things into account somehow in the future. So at the moment, we are kind of only aware that most likely we have a very Western European an Anglo-American bias on these things. So I'm just wanting to open a discussion about this. Okay,
Great.
that's all for me. And I just want to say that we have also other board members here. We have Luca and Elizabeth, say hi, who are also judges. And then we have Vidar, who's going to count the score. And then we have also on the board Dan, who was supposed to be hosting also today, but unfortunately the situation in Israel is, as we know, quite difficult at the moment, so he wasn't able to come. But that's for International DP Society. Thank you all for coming.
Wonderful. Thank you, Anna-Maya, our esteemed president of the International DP Society. And so we are almost just about to start our competition. Before doing so, I want to invite our expert judges to present themselves. So today we have Luca Rossi and Elizabeth Rosen as our wonderful raters. Luca, would you like to start in presenting yourself?
Oh, yeah, I'm Luca. I'm from Italy. I have a private practice and I work with intensive short-term dynamic psychotherapy, ISTP. And I am the vice president of IDPS. Yeah, a teacher and a supervisor in ISTP and in deliberate practice. So I'm really honored to be one of the two judges today. Looking forward to start.
Thank you, Luca. And Elizabeth, would you mind presenting yourself?
Okay, so I'm the other judge here today. And I mean, if the contestants feel a little nervous, I am on the same page. I feel also nervous. It's a very honorable mission to have here. So, well, I'm in Sweden. I have a private practice and I'm a dynamic therapist, and I also do dance therapy. So I have a lot of eyes on the nonverbals. But it feels wonderful to be here, and I'm so happy to see all of you here. So let's go.
Wonderful. Let's go. So how is this going to work? So we have skill criteria, which some of you might already know is our way of rating the skill that's going to be performed today. I'm going to give first just an overview. I'm going to show the skill criteria that we're using for today's competition. And then we have 3 final contestants. I will send 2 of them to a breakout room so that they don't get spoiled on the videos they're going to be working on. And we'll stay with just the first contestant. I'll present each contestant as we go along. Okay, so but as everyone is here, let me first just share my screen and show everyone today's skill criteria. It's actually a topic I personally love, and I research on therapist persuasiveness and providing treatment rationales. So today's skill criteria, meaning what the contestants will try to do after watching a client video, is to first express appreciation for the patient's statement, then give a rationale for how therapy or therapeutic tasks might help the patient. And finally, it's a non-verbal criteria. As you are doing this, expressing appreciation, giving a rationale, try to maintain eye contact, use a calm and expressive tone of voice, and a fluent speech. Okay. So the participants will be rated from 0 to 2 on each of these criteria in their responses, and they will respond to 2 client videos. Okay. So I am going to send Isla and Orion to a breakout room now. So we'll see you in a couple of minutes, and then I'll bring them back as we are done. So see you soon. I will put them on a different breakout room here. Let's see if it worked.
Oh, hey, Alex, would
Yeah.
you like to introduce the finalists first to tell something about them?
So I'm about to introduce the one remaining contestant.
Okay.
Yes,
That's
yes. So Isla and Orion are already in a breakout room. So let us start with our first contestant for today, who is Armand. Armand, are you here?
Yes, I'm here. Hello.
Wonderful. Hello, good to meet you.
Good to meet you too.
So let me just briefly introduce, and then you can also add anything you might like. So Armand is a first-year graduate student at Palo Alto's University in the clinical mental health counseling program. He has a lifelong appreciation for counseling that spans all the way back to the second grade. Love to hear more about that. In his spare time, he likes to teach programming, create video games, and review movies. So, of course, Armand, the only question here, and this is a 5-point bonus question, what's the movie you'd recommend for our participants today?
Oh, okay. It happens to be my favorite movie. It is a Russian movie called Stalker from 1970.
Oh yeah, love it.
All right, that's 15 points. Anyone who hasn't
I'm so
seen
glad to hear.
Stalker by Tarkovsky, please stop the Therapist Throwdown and go watch Stalker.
Highly recommend it. Beautiful movie. Very
Yeah.
beautiful movie.
Yeah.
Amazing,
Yes.
amazing. Well, Armand, how are you feeling about the competition today?
Naturally a little nervous. Glad to be here though. So grateful. Love to see everyone here. We're all in the right field. I'm very happy to be here.
We're very happy to have you. So, do you have any questions around what's gonna happen, basically?
No, I'm good.
All righty. So again, here are the 3 criteria. Each client video you're gonna see also starts the first 10 seconds show these criteria again. And so then at the end of the video, there will be a prompt saying, now you can intervene. And so when that prompt shows up, you can just try your intervention, okay? Again, expressing appreciation for the client's statement, giving a rationale, and paying attention to those nonverbal behaviors. All right, are we ready?
Yes.
All righty, let's go. First round, first video.
I lost my partner earlier this year, and well, I mean, the kids don't really want to talk about it. And I mean, I'm not any better, but it would probably be really good for them to talk about it. But I don't know, they keep avoiding it.
Yeah, well, I'm glad that you're trying to get them to talk about it. I think that's a good first step, especially everything that's happened. But we can find ways to open up a dialogue with them and sort of have a healing conversation. We can do that together.
Okay, thank you, Armand. So let's throw it to our wonderful judges. Luca, Elizabeth, let's give them a second to do their ratings and give feedback. I'll show again the criteria here. Luca, looks like you're ready.
Yep.
All right, feel free to.
Yeah. Skill number 1 is a 2. And skill number 2 is a 1. And skill number 3 is a 1. Can I give a little bit more articulated
Please do.
feedback? Okay. Okay. Only on feedback on skill 2 and 3. I would like to hear a little bit more about how you think therapy could help him or her. And I think the non-verbal was a bit, probably because it's the first round, but a bit less calm and warm voice than I think you could use.
Thank you. I appreciate that.
Elizabeth.
Yeah, okay. So for the first one, I mean, express appreciation. I think you nailed it. It was really nice and welcoming, your expression of that. So that's definitely 2. Be careful you do the switch to the next one with a but. Please use rather a and instead. It's a better word to connect things. And for the rationale, I'm also missing, as Luca said, you're telling the person what you're going to do. That was very clear, but you didn't tell how it will help. So that was missing. That's why it's a 1. And on the last one, I think also it was clear what you said, but it felt a little fidgety, like not really safe. So that's a 1 as well. But thank you so much. Well done.
Yeah, thank you. I appreciate the feedback.
Great. Someone asked what's the rating scale we're using, and just to touch on that very briefly. So a 0 means basically that the criteria was not met. A 1 means it was somewhat met, could be improved, but it was met in some way. And a 2, the criteria was completely met, like just perfect. So we're using that rating from 0 to 2. Great. All right, shall we move on to the next video?
Yes.
Round 2. All right. Good luck.
To be honest, I don't see the point of talking about my mother. That was a painful relationship. I don't want to remember it.
Yeah, I mean, I understand not wanting to talk about it, and I appreciate that you're bringing that up. You know, these feelings can really hurt. And I think that if we keep talking about it, we can really make it something that doesn't hurt quite as much to think about, and really make it a part of you that you can work with and grow from. And it would really help us to dig deeper.
All right. Thank you, Armand. So let's throw it again to our judges, and Luke, Elizabeth, when you're ready, feel free to speak. You ready, Elizabeth?
Yes, I
Right,
am.
go for it.
Okay. So I really appreciate that you thought about, oh, what kind of feedback did I get last time? And so you really improved on that one. I really like that. So wonderful how you really express your appreciation for what she's saying. That's definitely 2. And now I will give you 2 on the second one, because you tell what you have to do, and you also tell her in what way it will help her to have her history with her in a better way. What was missing in the end, though, in the nonverbals, is when you had to think, it became a little stumbling and not so fluent. So it's still a 1 on the last one, on the nonverbals. But thank you so much. You improved. Great.
Thank you.
So 2-2-1 then, Elizabeth?
Yes, 2-2-1.
Great.
Luca?
Hey, yeah. I basically agree with Elizabeth. Skill number 1, yeah, it's a 2 for sure. And it was great the first round, still great at the second. I really love that for skill number 2, you clearly improved in following the feedback that we gave, and that's great. And I'm a bit impressed in how fast you improved after the feedback. So congrats. And for number 3, once again, yeah, it's 1. I thought about it until the end, because it's 1.5. Because I would like to add half point, but yeah, if I have to choose between 1 and 2 is 1, because yeah, we could see the thinking, and it was not so fluent, because obviously you are trying to improve and do it better. So yeah, I would like to give us something more, but yeah, you did more, and that's great. So
Thank you.
2-1, Vidar.
2-1.
Thank you. I appreciate the feedback.
All right. So, congratulations, Armand. I was very impressed.
Me too.
And so, much like in Tarkovsky's Solaris, I'm going to send you into a liminal space called the Zoom breakout room.
Yeah, I
Thank
also
you.
want to say that is really great thing to do in live and not seeing any of these prompts before. And persuasiveness is one of the most difficult skills. So this year we have a real challenge. Yeah. Thank you, Armand. Yeah.
Thank you.
Thank you. I appreciate it.
All right, so let me do some Zoom magic here. So Armand is going to the breakout room, and I'm gonna bring in Isla. Let's see if this works. Okay. Yes. Great. Okay. Isla, are you here?
Yes, I'm here.
Hello, how are you?
Hi, fine, nervous.
Good. So let me just very quickly present you. So Isla is a third-year counseling psychology doctoral student at the University of Louisville, Kentucky, USA, with interest in health psychology and equity. And she enjoys time with her loved ones, plays flute, I believe, and rowing on the Ohio River. Oh, so nice. How are you feeling? You're saying a little bit nervous, Isla?
Yeah, it was helpful to like chat in the breakout room though.
Great, great. Well, don't worry, we have very compassionate judges with us here today. And let me know if you have any questions. So again, there are the 3 skill criteria that we're working from today: expressing appreciation for the patient statement, giving a rationale, and paying attention to those nonverbal behaviors, maintaining eye contact, fluent speech, etc. We're going to show you 2 videos, and you're going to get rated on the 2 videos. Any questions before we jump in?
Nope.
All righty, so let's go for it. All right, so first round. Oh, sorry, that didn't go anywhere. Okay, now first round.
I lost my partner earlier this year, and well, I mean, the kids don't really want to talk about it. And I mean, I'm not any better, but I don't know. It would probably be really good for them to talk about it, but I don't know. They keep avoiding it.
I'm really sorry you lost your partner. And I hear that your kids have some hesitancy about talking about the loss and their feelings. And it sounds like it's difficult for you to talk about too. But we know that being able to talk about these things in therapy and with other people in your life can really help you out. And we can go at your own pace and work on this together. And it sounds like you came here for a reason. So we can start talking about it at a pace that feels comfortable to you. How does that sound?
Pretty good to me. But I'm not a judge. So let's give Luca and Elizabeth a moment, and they'll give some feedback.
Okay.
When you're
Can I
ready.
go first?
Sure.
Great. So skill number 1, express appreciation is a 2 on my side. And yeah, I think you get it. You really convinced me about you feel the appreciation, and that's good. And
I'm sorry, Luca, I might not have mentioned to Isla. So the scale is from 0 to 2, just so you know.
Oh yeah. Okay. So top rated for skill number 1. For skill number 2 is a 1, and because of 2 things. The first one is you clearly focused on what you will do with the patient, what we will do together. And I would like to hear more about how the therapy will help him. And the second thing is something that a break moment between express appreciation and giving it rational. Something like it was not so fluent, the movement. And that's why nonverbal is still a 1, because I think it was not so fluent, good enough, not the top.
Right. Elizabeth.
Yeah. Okay. I loved your start. That was just amazing, and I was close to having tears in my eyes. It was beautifully validating why he was there, although he didn't want to talk. So I really liked that. Great appreciation for his statement. I disagree with Luca. I thought it was a very subtle and nice way of telling him what you were going to do together, talk, and that will help him in the long run. I think that was a very subtle but enough rationale for the moment to not overwhelm him. So I like that. So that's a 2 for me for the rationale. Although in the end, the nonverbals, it's a little, sometimes it's not extremely fluent. It could be a little improved. So that's one of my own keys, one of my keys here. And still there is one thing, the connection between the 1 and the 2 of the statements here is still, you say, oh, you don't want to talk, but it will. So here again, I would love you to use, and we know that it's helpful, or it's like an end, to connect with an end instead of a but. So, but very beautiful beginning. I really love that. So 2, 2, 1 for me.
Great.
Luca, I need you to repeat your scores. Your first one was 2, and then
1, 1.
2, 1, 1.
Yeah.
Thank you. And you, Elizabeth, 2, 2, 1.
Yes.
Thanks.
Great. Peter, our math expert, everyone. All right, Isla, are you ready for the second video?
Yes.
All right, let's jump in. So, round 2, let's go.
To be honest, I don't see the point of talking about my mother. That was a painful relationship. I don't want to remember it.
I hear that you don't want to talk about your mother, and that makes a lot of sense because, like you said, it was very painful. we can start really slowly. We can talk about a lot of other things going on in your life, but it sounds like you came here for a reason, that the pain with your mother is getting in the way of what's going on in your present. And as painful as it is to kind of go back in time, will help you live the life you want to live now in the present. But like I said, we'll start really slowly and we'll talk about many different things.
All right. Thank you so much, Ella. All right, let's give our judges a moment.
I go first?
Go for it.
Okay. So again, Ayla, beautiful. I love your tone of voice. But in the beginning here, to express appreciation, you really do that to validate what's going on for her. So really underline what she's saying. That's beautiful. So that's a 2 for me for the first one, express appreciation. Giving the rationale became a little messy. You were kind of trying to do it, and then you got there in the end, but it became a little fuzzy and fluffy on the way. So that will make it a 1, and that will also drop over to the non-verbals because it became a little too many words and a little going back and forth. But I really love the tone of your voice. So great. So it's a 2, 1, 1.
Right.
Thank you.
Okay. On my side, express appreciation. Yeah, you are on the top, and you're still on the top. There's a 2. Totally on the piece, and yeah, it works. And this time I don't agree with Elizabeth, and I agree about it was a bit too much words and a bit fuzzy, but I could see an improvement in trying to explain how you can help her. So from my point of view is a 2, and still a 1 for the skill criteria number 3. Still a 1 because of yeah, a little bit too much words, or yeah, a little bit fuzzy, but yeah. So 2, 2, 1.
Great. Thank you, Luca.
Interesting. We can see the subjectivity of this, isn't it? Yeah, thank you so much.
It's almost if psychotherapy is subjective to a sense, right?
Surprise.
Iowa, how are you doing?
Good. This is really fun in a way and helpful. So thank you.
Well,
Yeah.
I think I speak for many or all of us that we are in awe of your bravery. You did fantastic.
Yeah.
And this is, I mean, most professionals would be quite anxious doing what you're doing, let alone early career. So thank you so much, Ella. So, oh, sorry.
And as we can see, I think this situation makes this nonverbal stuff even harder. And because I've seen all the contestants also in preliminary round when they could do this in their own time, so that then they scored much more too on this the nonverbal stuff. So the situational things also come here. But like I said, Isla's tone of voice is kind of there. It's the basis where the on this kind of nonverbal comes to. Yeah, great. Thank you.
Well, thank you again. So Ella, I'm gonna put you for a moment back to the breakout room, although you are getting a lot of support here on the chat, which is great. I'm gonna throw you there just for a minute and we'll have our final contestant come in, okay?
Okay.
So let's see here. Here and great, and Armand here. Okay, let's see if that works. Right.
Hello.
Orion?
Yes.
Hello, good to see you.
Good to see you too.
All right. You were in this liminal Zoom space for a while. Sorry about that. Good to have you.
All good.
So let me give just a quick presentation on Orion. So Orion is an existential psychotherapist based out of Tel Aviv, Israel. His approach combines a mixture of applied existential philosophy, meditation, and non-duality. He sees patients in Tel Aviv and remotely on Zoom. He's into CrossFit. He's a coffee addict. And he is on the quest to find the best pizza in any given space around the world.
Wow.
Welcome, Orion.
Really try.
As far as missions go, that is a very laudable one. Congratulations. And
Thank you.
when you come to Lisbon, we can go for a hunt for the best pizza.
It is decided.
Great. How are you feeling?
I'm good. I'm good. Just a bit of anxiety. Maybe I shouldn't have had that coffee, but good.
That third coffee?
Yeah. You know, the one that does it all.
So, as you know, we have two judges here, and they are going to rate you on 3 skill criteria: the expressing appreciation for a client statement, giving a rationale for how therapy and therapeutic tasks might help the patient, and paying attention to your nonverbal behaviors as well.
Right? Sounds good.
So we're going to show you 2 videos. Any questions before we jump into the videos?
Nope.
All right. So let's go for it. Round 1.
I lost my partner earlier this year, and well, I mean, the kids don't really want to talk about it, and I mean, I'm not any better, but I don't know. It would probably be really good for them to talk about it, but I don't know. They keep avoiding it.
I can only imagine how hard it must be to be carrying all this weight. I can hear that even as you said those words. And by the sounds of it, there are 2 things that we might want to clarify here together. First of all, like you said, how and if we should be looking at helping your kids cope with this loss. And also, it seems like there's also a lot of weight that we might want to examine on how we help you walk through it and carry it for you and also for your kids.
All right. Thank you, Orion. Luca, looks like you're ready.
Yeah, I think so. And yeah, it was very hard to judge because yeah, everything was really good. And now I will go more specific, but in general, it was real good. And I only tasted something that was not exactly what I would like to hear, and it took some time to clearly focus. And so, moving to the skill criteria, express appreciation is a 2, and I could see you really involved, and the way you look directly to your patient while you are speaking was connecting and moving. So that's great. And giving a rationale, I was in doubt between 1 and 2. At the end, I choose for a 2. It wasn't so clear from my point of view, the how you can help him, and but yeah, I decided for a 2 and a 1 for the nonverbal, because in my opinion, what makes me so not certain was something in the tone of the voice of, yeah, the verbal fluency more than the content. So my final rate is 2-1.
Thank you, Luca.
Yeah. It's funny. I was stuck on the same item here, the rationale. But so for the first I rate a 1, and then I said no, it's a 2. It's a 2. So for the first one, express appreciation, that was very clear. You were really there in your eyes and tone of voice and in words. So that was beautiful. And then it was a little forth and back, but in the end you came there with what you were going to do in therapy, what was going to happen, and how it will help. And what I especially appreciated was that it was not just help for him. You also mentioned that will help you and your kids. So that was very nice because he was really worried about his kids. So I really appreciate that. So it was not just for him. But I have a 1 for the last one, the nonverbals, and that is because of the verbal fluency. You were a little searching for the words. So for me, it's a 2, 2, and 1. Thank you so much.
All right. Thank you.
Sorry to interrupt. So just to make sure about your scores, Luca, you also had 2-1?
Yep.
Right? Okay. Thanks.
All right. So Orion, I know you're a fan of existential philosophy. So like Jean-Paul Sartre would say, hell are other people. Hell is other people. In this case, the judges are hell. But not really. You did
Not really.
fantastic. Great. Are you ready for the second clip?
Yeah, let's go.
Let's go.
To be honest, I don't see the point of talking about my mother. That was a painful relationship. I don't want to remember it.
I see what you mean, and I also see how you move as you speak about your mother, but I would like you to consider that the pain is what might be driving some of these unease that I'm seeing within you right now. And while I know that this must be very hard for you to come here to therapy and address that, there might be something there. It's not just by miracle that we're talking about her. I mean, I see that this is moving something within you right now.
All right. Let's again just give our readers a minute.
Yeah, okay. So again, your appreciation for the client's statement is very clear, and it's beautiful. You're right there. And you also use her words of pain to also motivate her to talk about it, that there's something moving in her with the pain that tells you that this is the way we should go, even though it's hard. So you motivate her, but it's not exactly clear how this will help her in the end, but it motivates her for joining in therapy and doing the work. So what you're going to do, it's pretty clear, but how it will help, it's not exactly clear. So for the rational, I will give you 1. Although for the nonverbals, I'll give you 2 because I thought it was more fluent, and you really went with her in the movement in a nice way. So for me, it's a 2, a 1, and a 2. Thank you so much.
Luca.
Okay. For skill number 1, express appreciation is a 2. I think it was hard to improve from the first round, but you did it, and it's a pity I can't give you a 2+, but it's like it's a 2+. And I thought a lot about giving the rational, and I partially agree with Elizabeth, and so from my point of view, is still a 2. I agree is not a full 2, but yeah, I can give you a 2-, so it's a 2. And yeah, the verbal fluency improved for sure. I don't think is a full 2 again. And so yeah, next year for 24 we will set something like between 1, 0 and 5 or something like this, because three numbers are so little. Yeah, if I have to choose, is a 1. So final 2, 2, 1. Thank you so much.
All right. So very exciting times. I'm gonna bring back our other 2 contestants. Yeah. Tony, you want to say something about their bravery? Because we're waiting.
Yeah. I would just thank you, Alex. I'd just like to highlight that the bravery of the courage of our contestants. You are doing something that literally no one else here has done, and as far as I know, very few other people on the planet have done, which is competing in a live therapy contest in front of a live international audience on Zoom, dealing with, as Anna Maja said, a lot of cultural, ambiguity, and trying to do nonverbals on Zoom when you're looking at something that's probably this big on your screen is kind of crazy. And to do all that live with, and you weren't shown these videos before, so it's all new and all fresh, and, God knows what time zone it is for you, especially Orient, and so I just want to say congratulations to all 3 of you. You're really setting a standard and being a role model for the rest of us around the world, and just, I think, inspiring everyone. So thank you for your courage today.
Thank you, Tony. Orion, Iowa, Armand, how are you doing? Armand, you were the first one to go back to the liminal space. How are you doing?
I'm doing good. It was nice to talk to the other 2 contestants on the side. Really lovely people, and I think they're going to give me a run for my money, or they already did. Yeah, really great.
Great. Iowa, you're with us as well?
Yeah, no, that was a highlight. So cheesy to say, but the highlight was like the breakout room. So you all missed out. But thank you. No, it was really, I was so scared, but I feel better now, and it was really fun. And I really appreciate the judges and everyone who worked to put this together, and everyone who attended on their free time, including my friends who came to support me. So yeah, thank you all.
Great. So in our minds, you're all winners. However, I will turn it now to our math expert Vidar to let us know of the final scores for our final contestants. If
Okay.
Vidar is here. Okay.
It was really nice to see both the contestants, and also the judges. I think it was really interesting to hear your the way you were reasoning about how they met skill criteria. We have a very tight race, and Armand and Ayla both sum up to 18 points each. They both have 18 points, and Orion ended up with 20 points. So our winner is Orion. Congratulations.
Congratulations,
What?
Orion.
Thanks.
Orion, how are you feeling?
Weird. Okay, I did not see that happening. Thank you. Thank you. This is awesome. Thank you so much for the feedback. I mean, it was all very pinpointed. I mean, these are definitely things I want to improve on. But this is great. This was a great experience. Thank you so much.
Great. We should definitely get you a celebratory. We know you're a fan of coffee, so we should get you a congratulations mug.
Thank you.
I want to say, of course, Isla, Armand, Orion, you will all get very nice diplomas for being our final contestants here. And I guess I want to turn again to Anna Maya, our esteemed president of the IDPS. Any word you want to say?
Yeah, that was great. And I just want to thank our contestants. That was something really, really brave you've done, and so nicely. And I've seen you all also in the preliminary round also, and you got some feedback from those. So really, I'm proud to have you in this contest. And we also have some prizes for you. So Orion, you will I will contact you and we will negotiate. You will get a kind of diploma and also 150 euros worth, which you can use to get some DP supervision if you like, or book awards. So we will go through how you would like to use that prize money. And because we have then both Ayla and Armand on the second place, so then you both will also get diploma, and you will both now get 100 euros, which we will negotiate how you would like to spend that in buying some books which you like on DP or something else, or buying some DP supervision or something like that. So, but of course we want to give prizes for people who come here, and this is a so great promo, and I hope you are really role models for everybody on the field, how you can, even in this kind of competition, you are able to get better with one prompt to the next one. So, and take in the feedback, which is very honest, sometimes sounding like really brutal. Also, it's not that easy to take in, but then you appreciate it and you take it, and you just develop even better skills. So I'm really, really pleased about this. Thank you all.
So I'm aware of time, and I know we have to wrap up soon. So I want to again echo everyone saying very much congratulations to our wonderful contestants. Thank you everyone for showing up. This Therapist Throwdown has been recorded. So for you contestants, you should definitely brag and send the link afterwards to your friends. We'll put it up on YouTube, on the International DP Society YouTube channel, and we'll let you know. The link for the International DP Society is on the chat. So remember, this is kind of a growing community. We're very proud that it's very international. Feel free to join us. We always want to collaborate with different people. So please do join us at the IDPS. And yeah, any final words from our judges, Elizabeth, Luca?
Just feel very honored to have been with you here. And it's been really a thrill. So thank you so much. I'm really happy for that. Thank you.
Yeah. It was a thrill, and I can only say that all of you were really brave, because I think it's so difficult to do it live in front of so many people and accept to be rated. I know it's hard, and all of you are really brave, and I'm really honored to be here today. So thank you.
Well, thank you, everyone. The Therapist Throwdown will definitely happen again next year as well, so keep tuning in. And if you need anything, want anything, please join the IDPS and let's keep the conversation going.